All right, so I'm getting a lot of questions about how do you treat joint pain, neck pain, back pain, neuropathies non-surgically. So it's a super easy answer. It's a complicated system sometimes, but the answer is pretty much the same for all of them. So anytime you have pressure on a nerve, wherever that nerve goes to, you start to have a problem. So if I start to pinch this nerve, either from a herniated disc, pinched nerve, inflammation of the nerve itself, or the nerve starts to degenerate, where that nerve goes to, you start to have an issue. So if this one's in my neck and it goes down to my fingers, then those fingers start to get tingling. If this is in my low back and this nerve goes down to my toes, then those toes start to get tingling. So one of the things we want to do with you first, or any doctor that you see, what you want to see is what's causing that pressure on the nerve. Is it coming from the disc? Is it coming from arthritis? Is it coming from nerve inflammation itself? Is it coming from, like I said, degeneration of the nerve? Or is it coming from somewhere further down on the foot or the ankle? So that's the first thing we do when we check you out. Now, the treatment depends on getting the proper diagnosis. So let's say it's a disc, let's say it's a bone actually hitting the nerve. What makes sense then is to bring the pressure off of that nerve, either reducing the pressure from the disc, reducing the pressure from the nerve. If that's not the reason why you're getting it, if you're getting it because the nerve is inflamed, then we want to do treatments that bring the inflammation down to the nerve. Or if the nerve is getting pinched somewhere down, either through the elbow or through the knee or down through the ankle, then that's where we want to relieve the pressure. So a lot of people say, I've went to a chiropractor or I've went to physical therapy, or if I've tried that treatment and it didn't work, so I'm not going to try that anymore, I'm going to go jump into something else. Just make sure that if that's the case for you, that you've been diagnosed correctly on what the actual cause of the problem is and not just the symptom. Because just because somebody gets tingling down their legs or somebody gets back pain or arm pain or neck pain, it's not always the same reason, even though it feels the same for a lot of people. So if you've been struggling with this, or you know anybody's been struggling with this and you want to come in and we can check you out, we don't have to treat you if you don't want to. We do a really good job assessing what the problem is, whether it's the nerve pinch, pressure, or a problem down the road. So feel free to reach out to us. If you have any questions, shoot me a text.